everyone. Sorry for the late and sorry for the delay because of the sometime it happens. है ना? Sometimes it's happens because of the lots of things which is the going on around the like the offline batches are going on, online batches, and exam is the around the corner. Everyone are they scared from this exam and they like the very tense. They are asking for the they are either they take the alprazolam, modafinil, propanolol क्या क्या ले भाई सबके लिए prescription बना के दो. So these things will be there. So high cortisol level is there, and right now, so like everything is going in the so much in the fast way. ऐसे घोड़े के जैसे दिमाग दौड़ रहा है अभी तो. So मेरा यही सजेशन है. Lots of people gone through these phases. I also gone through these phases. So ये एक पल है, एक समय है जो गुजर जाएगा और इसको बेस्ट वे से खेलना है. और दिस इज द योर लास्ट इनिंग विच यू लाइक द मेक इट हैपन्स इन द बेस्ट वे, इन द ग्रेट वे. ठीक है, तो उसका सबसे बेस्ट फॉर्मूला ये है कि नेक्स्ट 5 days में पढ़ाई नहीं छोड़नी है. नेक्स्ट 3 days 2-3 days में आपको पढ़ाई करनी है, पढ़ाई नहीं छोड़नी है. एंड व्हाट इज द कंट्रोल इन योर हैंड, जस्ट डू ओनली दैट पार्ट. ठीक है, तो इसको बोलते हैं डाइकोटोमी ऑफ द कंट्रोल. वट एवर कंट्रोल इन योर हैंड, do only that part, and rest leave on the God and the Almighty. Okay, and don't think too much and don't stress out. And the paper कैसा आएगा, टफ आएगा, इजी आएगा, मैं बता दूं पेपर आएगा, पेपर विल बी द सॉल्वेबल. ठीक है, अरे मैंने सारे एग्जाम फर्स्ट अटेम्प्ट में क्लियर किए विद द गुड मार्क्स. ओके डॉक्टर सौरभ, आई क्लियर द ऑल द एग्जाम इन द विद द गुड मार्क्स इन द फर्स्ट अटेम्प्ट्स. ओके, so what I was talking about these things that is in the exam time all the things will happen. ठीक है, तो लास्ट तक खुद को एक तो कंट्रोल में रखना है और खुद से बोलना है कि आई कैन डू इट एंड आई विल डू इट बिकॉज आई मेड द एफर्ट्स, आई मेड द हार्ड वर्क फॉर दिस वन दिस कंडीशंस. सो इससे अच्छे से और क्या हो सकता है. ठीक है, तो इसके लिए कुछ भी टेंशन नहीं लेनी और लास्ट 3 days में भी पढ़ाई करनी, पढ़ाई नहीं छोड़नी. हो सकता है कि लास्ट के डेज में आपने जो पढ़ा वही 20-30 क्वेश्चन आ गए. ऐसा हुआ था एग्जाम के टाइम पे, हमारे टाइम हुआ था. मैंने और मेरे दोस्त हिमांशु ने, हमने रात को ऐसी पीडीएफ फाइल देख रहे थे एग्जाम से एक दिन पहले, 5 क्वेश्चन आ गए तो उस इमेज वाली बुक से विच आई सेंड यू. तो वो एक होता है ना, वो एक चीज होती है दिमाग में कि अब बढ़ेंगे, दिमाग में नहीं आएगा. नहीं, जब खाली बैठोगे तो ओवर थिंकिंग होगी. अगर ओवर थिंकिंग होगी तो एवरीथिंग विल बी इन द वर्स्ट सिचुएशन. सो अपन को क्या करना है, वर्स्ट सिचुएशन में बेस्ट परफॉर्मेंस करना है. तो उसके लिए ये कि पढ़ाई करते रहना है. ठीक है, एफर्ट्स मारते रहने एंड बिलीव इन द योर एफर्ट्स. ठीक है, कुछ भी नहीं किया है, मतलब कुछ भी नहीं किया, फिर भी ऐसे सोचना है कि 50-60 क्वेश्चन तो मैं ऐसे कर दूंगा, बाकी बीसी लगा करके 160+ मार्क्स आएंगे. तो इस तरीके पॉजिटिव माइंडसेट के साथ जाना है. एग्जाम में भी काम एंड कंपोज तरीके से जाना है. फर्स्ट पेपर ऊपर नीचे हो सकता है बट सेकंड पेपर विल बी योर्स. ठीक है, एंड सर्जरी ओबीजी दैट विल बी सॉल्वेबल. और इस बार गवर्नमेंट पूरी बैक फुट पे है तो पेपर टफ तो बनाने का कोई सवाल ही नहीं उठता. एंड पेपर विल बी इन द योर कंडीशन, इन द योर फेवरेबल लाइक द पार्ट. ठीक है, सो दैट्स द ग्रेट, है ना, ग्रेट डॉक्टर सौरभ मेडिसिन, है ना. देन वी आर स्टार्टिंग. yes, I will say in the both language, English and Hindi. Most likely the content will be in the English part, so no worries. Just I want to like talk as a like the brother. That's the main thing, which is like the everyone are like the doing the formalities and all. मैं एक रो इमोशंस बता रहा हूँ कि एग्जाम हॉल में क्या होता है. लास्ट क्वेश्चंस तक आप खुद को एकदम पूरे काम एंड कंपोज. वी नीड टू बी इन द लाइक द काम एंड कंपोज मोड. ठीक है, एंड there is a golden rules which senior taught me, like the one time one screen one questions, only focus on this one. I will not think about the previous one, I will not think about my future MCQs, I will think about this one. Even they are asking about the down syndrome trisomy. ठीक है, डाउन सिंड्रोम ट्राइसोमी which chromosome, but I will think about I will see all the options, I will see the last line, then I will read the fully with the fully concentration, I will mark that one and go through, then we'll go ahead. Okay, so that is the main thing that you need to be in the like that's kind of the zone. So we are starting from the first one. And what is these kind of the PYQs? These are the PYQs which I extract from the 2017 to 2026, 2017 to 2026, which I compared I compared the 925 questions. Out of that one, I extract these are the which is the like the most ignored questions, or the like people tends to make the mistakes, these kind of mistakes called the silly mistakes. So I like the extract these kind of the questions, and 100% out of these 175 MCQs out of the like the 40 MCQs will be there in your exam directly and indirectly manners, and we will meet after the exam. So no worries, just be with me for the next 1.5 hours, okay, and we will make it happens in the best way. Okay, so we are starting from the question number first. This is the like you need to just answer that one and we will go through. And I didn't I didn't give the options, okay, intensely I didn't give the options because of the when your options will be not there, still you are the like recalling everything, that will be there like the cherry on the top. Okay, so that one we need to remember. Next one. So question number first, significant p values for the rejecting the null hypothesis. There is a p value, significant p value for the rejecting the null hypothesis. What does mean and how much it will be? Please answer in the comment, so we can start from the first questions, and this one will be there. So there is a p values. If p values is less than 0.05, that is a significant one. If there is a less than 0.01, then is highly significant. If there is a p which is the 0.001, which is the very highly significant. What does mean of that one? That is a mean is the very simple one. Please reply in the comment box so I can check. Okay, ठीक है. Yes, and this is the like the, if there is a, what does mean? If there is a 0.03, that is significant, that is a reject H naught, that does mean there is a drug likely to the real effect, that is drug have the effect and that drug is making the effect. So that is a P001. That is 008 means that is a not significant. If there is a, this is the like the more than 0.05, that is a not significant, that is a fail to reject the H naught. Okay, that is a evidence that is insufficient to the like the prove the effect, that one. So it is a what is the answer here? Here is the answer is the answer क्या होगा भाई? 0.05. This is the like 3 time FMG PYQ repeated it. Okay, so type 1 error, in the type 1 it's a alpha 1 error, it's false positive 1, it's rejecting the null, the true null hypothesis. Okay, and in that one I gave the example, I will send you that PDFs. So coming back to our next questions, that is a question number 2, that is a Framingham which type of study? Framingham, what kind of the study it is? Like the court or the case control or the cross sectional? Yes, it is a cohort. There is a two type of the cohort, that is a prospective cohort and a retrospective cohort. So that one we need to remember. It's FMG Gen 2025 questions. There is a they ask regarding the prospective cohort, and out of them they are asking that is a, what is a benefit for the prospective cohort and what is the like the demerits for the prospective cohort. So that one we need to remember. In the prospective cohort, which is the present to, they are like assuming for the futures, and there is a, this is the like the expensive studies. Okay, this is the more expensive studies and they are requiring the more time as compared to the retrospective, and we will goes into the fast manner. So we are not discussing the whole the concept, whole the things. We want to just learn the things which will matter in your exam. So that one we need to remember. Okay, go ahead. So that is a ADOC 40-50 MCQs. Okay, if you will go through this PDF. Okay, and in the prospective cohort and the retrospective cohort, which is the like the taking the less times and it's the cheapers, but what is the main things here is the recall bias is there. Okay, here is the recall bias is there. Recall bias. So that one we need to remember about the prospective and the retrospective cohorts. Next one, which of the following, this is FMG Gen 2025 questions, 2023 questions and 2017 questions, and also it's repeated in the NEET PG 2023 questions. Which is the vaccine which is contraindicated in the pregnancy? Which vaccine is the contraindicated in this pregnancy? That is a, that one we need to remember. That is a rubella vaccine, which was the answer given in the like previous one, but we need to remember this is the I love chick embryo. What does mean of the I love chick embryo? That is I love chick embryo. So that one we need to remember. I say influenza. That is a love. Love means live vaccines. That is a live vaccines. Chickenpox, and E say that is thing which we need to remember. There is a MMR vaccines, varicella vaccines, and live attenuated influenza vaccines. That is a influenza vaccines, and RC that is a rota one, and O say oral polio vaccine, and BCG, that one we need to remember. What is the strain? What is the strain name of the BCG? Yes. What is that is a name? Like Oka is the for that one. ओका किसके लिए? एडमान जागरेब किसके लिए? ओका for the, please recall it. Oka and the एडमान जागरेब्स. ओका. दानिश for the BCG. दानिश है ना? Yes, एडमान जागरेब्स for the measles. Measles को हिंदी में कहते हैं खसरा, and then it's rubella. It's rubella. Oka is for chickenpox. And here is the drug of choice, which is the fluconazole 150 micrograms. ठीक है? Drug of choice is fluconazole. This is the FMG 2021 questions. Fluconazole 150 micrograms. So that one we need to remember. That is Zagreb, which is the measles, and measles you need to remember everything which is related to it. Can be the scene in which the malnutrition patient with the present of vitamin E deficiency, where is the drug dose is different. If less than 6 months, then it's 50,000. Then 6 to 12 months, then it's a 1 lakh, and more than 12 months, then it's a 2 lakh. So that one we need to remember. And also that is a weight. If it is a weight is less than 8 kg, then it's a 1 lakh, and its weight is more than 8 kg, then it's a 2 lakh. So that one we need to remember. Also measles, that you need to remember, that is a cough-like spot you will see, cough-coryza conjunctivitis you will see in that kind of conditions. Okay, that one we need to remember. एक मिनट विशाल भाई, एक मिनट आना. ठीक है? So that one we need to remember. Next one, the black color triads, it's indicate what? Black color triads, it indicate what? That is a triad which is already asked, and recently happened to so many incidents, like in the Delhi and around the like the today in Venezuela, that is like the more than 1 lakh peoples died in the like the earthquake. So black color, which is the dead. Okay. So once a time they ask this one black dead, and another one in another exam they ask like this one, that's a GCS score. How much will be the GCS score? 0 or the 3? The 0 or the 3? 0 or the 3? It's GCS 3. GCS 3. Now red, that the red once a time the FMG questions they ask this one, the red which is the like the immediate treatment needed, it's life threatening condition, patient can be the died or can be the die, and so that one we need to treat as a priority. So that one we need to remember. Next one, yellow, which is the like the delayed treatment, and it's not serious, but it's not like that much serious as the red is serious. So that one we need to remember. Next one, the green, which is the ambulatory, it's a minor fractures, it's walking, or the ambulatory. Okay. Black, which is the dead, or most likely they will like the least likely to be the survive. Okay, so that one we need to remember. Yes, Dr. Ring Lover. Next one, that active form of the vitamin D. What is the active form of the vitamin D? That one we need to remember. And also active form of the vitamin B1 is also we need to remember. The vitamin B1 active form is the thymine pyrophosphate. That is a B1. Okay. Vitamin 100% exam question set. So that one we need to remember. The calcium. What is it? What is that one? और अनदर वन विटामिन डी के बारे में एक और चीज ध्यान रखनी, दिस इज द ओनली विटामिन विच इज द एक्ट एज अ हार्मोन. ठीक है, एक्ट एज अ हार्मोन विटामिन डी. And Aina said in the 2019, Aina said they asked what is the earliest time for the vitamin D deficiency rickets. D deficiency rickets, that is the earliest sign. So there was option in bowing of the legs. There was the frontal bowing, Harrison sulcus, or the another one was the craniotabes. So the correct answer is craniotabes. Craniotabes is the earliest sign for the vitamin D deficiency, that is rickets related. And where you will see the rickettsic rosary in the vitamin D deficiency, you will see the rickettsic rosary, which one will be the non-tender, non-sharp, and the non-painful. So that one we need to remember, this one. So it is a active form of the vitamin D. Vitamin D, it's a 125 dihydroxy cholecalciferol, and which is present in the kidney, and it's a calcitriol, which is the already asked in the FMG exam. So that one we need to, that is a flow chart we need to remember, where it will be the 7, where it will be the 25, where it will be the 125. What does mean of that one? That is a skin, where it will be the that is a first, that is sunlight which coming that hitting to the skin, and skin will be the, that one will be the 7. Then it will liver in will be the 25. Okay, and then kidney it will be 125. So that one we need to remember, and that is at 125, which is the active form of the vitamin D. And vitamin D, you will see the Harrison sulcus, you will see the bowing of legs, you will see the wind shape deformities, you will see the craniotabes, ping pong balls. Okay, that is the earliest sign. That is the earliest sign. That widening of the sutures, that widening of suture, that one we need to remember about it, this one. Okay, great. Most reliable test for vitamin D status, that is a serum 25 OH. Okay, 25 hydroxy. So that one we need to remember. And the kidney enzyme, that is a 1 alpha hydroxylase, and PTH, which is the activate the vitamin D in the kidney. This is the FMGPYQ. So that one we need to remember about the vitamin D. Next one, which hormone stimulate the calcitriols, that formations? Question number 6. This is the PTH, which we already discussed in that manner. Next one, glycemic index, which is the very important one. Glycemic index, which they will show you, that they are like the making the effect on the the glucose in the blood, what kind of the taking the times and all. That is glycemic index. That for the glucose, it is a standard one. It is 100. So there once a time they ask this one. There is a high glycemic index food, that is a white breads, potatoes, cornflakes, white rice, and the glucose. Another one they gave this one, canned food. Canned food, because of the preservatives and all, they have the high glycemic index of that food. So we need to avoid in these kind of the the high glycemic index foods. They are the spiking that the blood sugars. Okay. Now the medium, which is basmati rice, the pineapples, and the sweet corn. Okay, sweet corn. Next one, low one we can give to the these kind of the patients, which are the diabetic patients, where is the dal and the chickpeas and the kidney beans, that is rajma, and the apple, orange, and oats. These are the low glycemic index food. So that one we need to remember. Wheat is also, yes. Now this one, this is the anatomic questions, the coracoid process. This is the coracoid process. This one is acromion process of the scapula. What kind of the epiphysis is this one? What kind of epiphysis? This one. Question number 8. This is the acromion. This is the acromion. This one is the coracoid process. This one is the glenoid fossas. ना ट्रैक्शनल तो नहीं है. The papaya is the different questions. ठीक है, this is also controversial questions. Once a time they give the options of the papaya, and the once a time they give the canned food. Canned food have the high glycemic index. Yes, it's a atavistis. It's a atavistis. So that one we need to remember. This is the already FMGPYQs. Atavistis epiphysis. Next one, question number 9. Then keratitis, keratic keratic precipitation, which is the seen in which corneal layers? Which corneal layer? There is a corneal layers which is anterior to posterior, which first one is the epithelium, another one is Bowman membranes, and third one is the stroma, which is 90% of the corneal thickness because of the stroma, and the another one which is descent membranes, and उसके बाद में आता है there is endothelium, which is the like the having the keratic precipitation in the deposit here in that conditions. That is a yes, correct, sir. Hello. What is the answer here? Here is the endothelium, which is already asked. This is the 2017 FMG Later on in the FMG Jan 2025, they asked this one anterior uveitis. Where is a keratic precipitation? You will see that is a seen in anterior uveitis. And once a time they give this photo of that one, that D shape, that is a iridocyclitis. That is a iridocyclitis. What is the site for this one? The site is corneal endothelium sites for the keratic precipitations, and that is typically locations. That is a Arts line, Arts triangle. That is a inferior corneal endothelium. That is inferior and endothelial corneum. Next one, that is clinical questions they used to ask. That is a mutton fat. That is precipitation. That is a suggestive what? Granulomatosis. Okay, granulomatous. That is uveitis. If there is a fine KPS, then it's a non-granulomatous. So that one, that is a mean differentiating factor between the granulomatous and non-granulomatous. Okay, there is a mutton fat, then it's a granulomatous. So that one we need to, this is the FMG Jan 2024 questions. FMG 2024 PYQ. So that one we need to remember. Yes, endothelial is the answer. Next one, that is respiratory papillomatus. It is caused by the which virus? Respiratory papillomatus. This is caused by, and another one, एक और वायरस होता है. There is a drug of choice is palvizumab. वो किस में देते हैं? Yes, doctor, string blowers. Correct. EBV is doctor different. EBV, which is the like the associated with the most likely, it will be the like Burkitt lymphoma, nasopharyngeal carcinomas, and infectious mononucleosis wala. Where is a monospore test is the positive. Okay, that is a EBV. EBV का याद रखना. और palvizumab is drug of choice of what? Respiratory syncytial virus. That is RSV. Respiratory papillomatus, that is HPV. That is a HPV. The HPV, that one we need to remember. Okay. Yes, Dr. Ritesh, correct. This is the HPV. Now, Epstein Barr virus की बात आ गई तो that one we need to remember. That is a Burkitt lymphoma. It is associated with Burkitt lymphoma. It is associated with the nasopharyngeal carcinoma. Okay, nasopharyngeal carcinoma and infectious mononucleosis. Where is a monospore test is positive. And in the nasopharyngeal carcinoma, you need to remember that is a unilateral conductive hearing loss, and also you will see the bite type B tympanograms, and also about the Burkitt lymphoma, you know the everything. Starry sky, translocation 28, 8, 14. Okay, and that one we need to recall, that Joe wala photo. Yes, Dr. Pratik, correct. That is HPV. Now, there is a contraceptive safe during the first 6 months of the lactation. Which one is the safe one? Safest one? Question number 11. Yes, Dr. Hemant Singh. That is a POP. That is progesterone only pills. Correct, doctor. That is a POP. So that one we need to remember. Now there is another conditions. There is a prosopagnosia. Prosopagnosia means what? This is to the FMG Gen 2020 2018 questions. There is inability to find the faces. There is a lots of, there is a meaning. There is a apraxia. Apraxia means cannot perform that learn the motor task. Apraxia. Apraxia is, it's a, this is the cannot perform that motor task despite of the normal strength. That aphasia, there is a language impairment in that conditions. Alexia, that is an inability to read. Agraphia, there is an inability to write. Graphia. Okay, can you tell me, there is the one questions about this one. There is a way in the which disease where you will see the micrographia. Micrographia in that conditions, in what conditions you will see the micrographia, like the micrographia, hypomemia, these kind of things. Yes, this is the Parkinson disease. In the Parkinson disease, hypomemia, slow voice, and the micrographia, छोटा छोटा बहुत छोटा छोटा लिखता है, that is a Parkinson disease. Now anomia, that is difficult to naming the objects. Acalculia, that is a inability to perform the calculations. So that one we need to remember. Prosopagnosia, which is already asked, and apraxia, which is already asked, and the that is a micrographia and hypomemia, which is already asked. So that one we need to remember. Now another one, which is the anesthesia or iska mixed questions. There is a, what is the correct order layer for the spinal anesthesia? What is the correct order for the spinal anesthesia? The layer. This is the layer which we need to remember. First, it will be the skin, then the subcutaneous tissues, then the supraspinatus ligaments, then infraspinatus ligament, then ligamentum flavum. Okay, so that one we need to remember about the spinal anesthesia. That is a spinal anesthesia. Skin, subcutaneous, that is subcutaneous tissues, that is supraspinatus ligament, then interspinous ligament, then ligament flavum. That is a 2-time FMG questions which is already asked. Okay. Yes, correct. डॉक सेशन इज स्टार्ट ऑलमोस्ट कितनी मिनट हो गई? It's already like the 20 minute 25, yeah. Though doc, it's not one liner. I made it in the one liner mode, but they will not ask you in the one liner, but still they will ask you that these kind of the buzzwords, but like the buzzword, or they will ask you the some kind of symptoms which is in integrated manners. I know the pattern. I know I am the like tracking these patterns from the since 2020. I'm watching the closely to the all the exam, NEET PG, FMG, INSET, and I like the made the metrics of these kind of the MCQs. I have these kind of 73,000 MCQs of these kind of the PYQs. So I know that what kind of questions they will ask, है ना? Okay. Next one, the correct order of the endometrial blood supply. This is a arcuate, then radial, then spiral, then basals. So that one we need to remember in the correct order. There is arcuate, radial, spiral, and the basals. Okay. Next one, what is the dose for the RDA of the calcium in the elderly woman? Question number 15. RDA of the calcium in the elderly woman. Yes, ARSB is correct. There is a 1200 microgram per day. So that one we need to remember. Next one, this is the FMG Gen 2025 questions. This is the cattle track. That is this kind of the cattle track. That is a box car cattle track. That is kind of the appearance, and the cherry red appearance. That is seen in what conditions? Yes, Dr. Devas, that is a CRAO and CRVO. That is a two type of the, that is a conditions. That is a artery occlusions where you will see the cherry red and cattle tract vessels appearance, and you that is a the blood thunders or the tomato splash. These kind of appearance you will see in the CRVO. Cherry red spots is not specific. That is can be the seen in the, like the Tay-Sachs disease. That can be seen in send-off disease. That can be the controversial Gaucher disease. Gaucher disease also you can in somewhere in the textbook also written there is a Gaucher disease. You will see the like cherry red spots. Okay, and also one Niemann-Pick you will see the cherry red spots. So that one we need to remember. भाई भाई इन सब चीजों का क्या मतलब है बताओ आप। डॉक्टर ऐसे इन सब चीजों का क्या मतलब है। देयर इज ओनली वे टू क्लियर दिस एग्जाम, दैट इज अ स्टडी, इसके अलावा और कोई वे नहीं है, ठीक है। बाकी इन सब चीजों नेगेटिव कोई मतलब नहीं है। यू आर इंटेलेक्चुअल एनफ यार। That is a CRAO. CRAO. So that one we need to remember. That is a CRAO. Chariot sports we already discussed the multiple time. इसमें कोई गलती नहीं होनी चाहिए. If there is a they are asking about TASEC, they will not give you the any kind of the hepatosplenomegaly because of the uh, and the TASEC have the tiny organs, means they have the no, there is a having the no hepatosplenomegaly. Okay, so that one we need to neurodegeneration, you will see, that is chariot, you will see. Okay, and send off A and send off B wala, that one we need to remember, hexominidase. And another one, that is Niemann Pick, where is recently that is already asked in the FMG Jan 2026, where they ask that is a foam cells zebra body, the foam cells zebra bodies, which is the seen in Niemann Pick, where is sphingomyelinase is deficiency in that one. Okay, yes Dr. Ayman, correct. Tomato splash or the thunder, that is a blood thunder, that is a blood thunder, that is a CRBO. Okay. Next one, question number 17, that is fundal height at the 24 week of the gestational. The fundal height at the 24 of the gestation, that is a umbilicus, that is a level up to the umbilicus. Dr. Divas, the glucocerebrosidase, that is in the Gaucher disease, that is beta glucocerebrosidase, that is Gaucher. Galactocerebrosidase, that is Krabbe. ठीक है, ये करेक्ट कर लो. There is a TASEC hexominidase A. Yes, this is the umbilical. Now, triple arthrodesis, that is a which joints are involved in that conditions. The joints involved, that is a subtalar, that is joints which is the involved, that is subtalars, talonaviculars, and the calcaneocuboidal joints. Calcaneocuboidal joints, that is a old PYQs. They can ask anytime. Next one, that post-traumatic watery nasal discharge suggesting of what? That is post-traumatic watery nasal discharge. That is suggesting of what? Thank you, Dr. Khan Saab. Thank you, Dr. Saab. Thank you. Yes, and here is the, there is sign, you will see the hello sign. Another one, there is a beta 2 transferrin test. Beta 2 transferrin test. So that one we need to remember. And here is diagnosis, which is the CSF rhinorrhea. Yeah, target sign, hello signs. Target sign multiple things में मिल सकता है. Target sign फिर से आ गया. The target cells which is the seen in the beta thalassemia, in the previous sessions we discussed about this one. Target sign on the USG, you will see the intussusception. और कौन से साइन मिलेंगे? क्लॉ साइन मिलेगा वहां पर, ठीक है. डोनट साइन, that is a donut sign मिलेगा. The target sign मिलेगा. And also you will see the red currant jelly stool. This is the target sign, that hello signs. ठीक है, CSF leak. So that one we need to remember. Next one, what is a normal optic disc diameter? Why I am asking this one? Because in the glaucoma, which is the actual definition of the glaucoma, it is that is increasing the optic disc ratio. That is increasing the optic disc, that is ratio. Yes, it is the, what is that? 1.5 mm. 1.5 mm. 1.5 mm. That one we need to remember. Next one, that Quintana fever is caused by the what? It's caused by the what? Quintana fever. Yes, Quintana fever, which is caused by the Bartonella quintana. That is a Bartonella quintana. Okay, which is also already asked. No, typhoid नहीं है डॉक्टर. Typhoid is the like the that is a stepladder fever. Stepladder fever you will see, and typhoid which is caused by the Salmonella typhi. There's Salmonella typhi, and which is the like that there is a There is a media which is the Wilson Blair media, where it will show the jet black colonies, and it's a non lactose fermenter bacteria, and it's like the drug which is we give the cefixime, and you will see the rose spots, and you will see that longitudinal ulcers. Okay, longitudinal ulcer, staphylococcus fevers, and a piece of diarrhea, and we will give that that is a cefixime we will give. And if they are asking regarding the IV, then we will give ceftriaxone 1 gram IV state in the slow infusions. Now, what is the most common site for the esophageal carcinoma in the India? Because there is a lots of controversy regarding the sites of that one. What is the site? Question number 22. That is a middle 1/3. That is a middle. That is a middle 1/3. India पूछा ना. Now there is a three appearance that one we need to remember. There is a one is the like the if there is a dilation in the mid esophagus is dilated, so that is indicating what? That is indicating that is a achalasia cardia. Mid esophagus, that is achalasia cardia. And what treatment we do for the achalasia cardia? Achalasia cardia, it is due to the like the failure of the relaxation of the LES means LES what? That is lower esophageal sphincter, which is the failure to relax. In that conditions where patient will present with the that is dysphagia, liquid more than solid. Okay, so that one, that is a main buzzword for this one. That is a liquid more than solid. In that one, in the red tail appearance, which is the seen in esophageal carcinoma, where you will see the dysphagia, solid more than liquid, and diffuse esophageal spasm, that is a corkscrew, that is a diffuse esophageal spasm, where you will see the corkscrew appearance. Yes, Heller's myotomy for the that is a Heller's myotomy for the achalasia cardia. Heller's myotomy. That one we need to remember. Okay, that corkscrew, it's a corkscrew appearance. Okay, corkscrew appearance. If they are asking regarding the corkscrew hairs, that corkscrew hairs on the like this one perifollicular hemorrhage, that is due to the perifollicular hemorrhage, you will see the corkscrew hair. That is a ascorbic acid deficiency, vitamin C deficiency, scurvy. You will see that is corkscrew hair, and corkscrew, that is motility based spirochete. ठीक है, ट्रोपोनिमा पैलिडम वगैरह spirochete में you will see. In the Menke you will see the kinky hairs. Menke में you will see the kinky hair, ATP7A, that is mutation you will see, and Menke kinky hairs because of the copper deficiency. Okay. Next one, 23. The laryngeal muscle which is not supplied to the recurrent laryngeal nerve. Which muscles is this one? Yes, it is a cricothyroid. So that one we need to remember. It's not supplied by the recurrent laryngeal nerve. It's supplied by the ELN. Yes. Tonsil pushed the medially and fever and chills, indicating what? Tonsil which is pushed to the medially and the fever and chills के साथ patient present. That is the condition which is called quinsy. What is the another name of quinsy? That is quinsy, where is peritonsillar abscess, which is peritonsillar abscess. That one we need to remember. Tonsil, that is a tonsil which is the like push the medially, and uvula is the opposite side. ठीक है, uvula opposite side. Uvula opposite side, and tongue and the tonsil which is the medially pushed. Question number 25, that one we need to remember. That is a parafollicular C cells which is derived from what? It's a antimobranchial bodies, because parafollicular C cell which is like the secrete the calcitonin, and which is the marker for the medullary thyroid carcinoma, and which is the associated with the MEN2A, MEN2B, and also associated with the amyloidosis. where is we use the to detect the amyloidosis, we use the Congo ray dispense, where it will show that like the apple bifurcated appearance. Okay, so that one we need to remember. Another one, liquefactive necrosis, classically seen in that conditions. Which conditions? Like fat necrosis, last time we discussed about the pancreatitis and the fat necrosis, which is also associated with the breast, traumatic breast वाले में and fibroadenoma वाले में. This time to discuss about the liquefactive necrosis, liquefactive necrosis, which is the seen in brain and CNS. Any kind of the CNS pathology, we will see that liquefactive necrosis, liquefactive necrosis. Now this one, Lake Hansen classification, it's used for the ankle injury. Ankle injury, this is the new for you. Okay, and the most cochleotoxic aminoglycosides. Most cochleotoxics. This time they can ask like this one. This time they can ask that is a cochleotoxic aminoglycosides, or they can ask like tetracycline or the amikacin. इनके अंदर जो mechanism of action, that is 30 years or 50 years. They can ask this one. If they will ask you then 30 years छोटे लोग कहाँ रहते हैं, अमी के पास रहते हैं. So amikacin, जितने भी amikacin, gentamicin, जितने भी aminoglycosides है, tetracycline, doxycycline, ये सारे 30 years. 50 years में कौन रहेंगे? Azithromycin, clarithromycin and erythromycin. So that one we need to, that is a 50 years. That is a 50 years. So most cochleotoxics, that is a kanamycin. That is a kanamycin. So that one we need to remember. न्यूमाइसिन का अभी क्वेश्चन आएगा. ठीक है, क्या क्वेश्चन है अभी बताऊंगा. दैट इज अ कोक्लियोटॉक्सिक, दैट इज अ कानामाइसिन. ठीक है, सो के सी से ऐसे कोक्लियो के काना, दैट वन वी नीड टू रिमेंबर. नेक्स्ट वन, creatinine synthesis involve the which kind of the amino acids? What amino acids which is the involved? It's involved the arginine, glycine and the methionine. So इनके क्या क्या क्वेश्चन बन सकते हैं? The arginine, L-arginine which synthesis what? Is L-arginine which is a synthesis the NO, and NO का क्या फंक्शन है? It's a vasoconstrictor, vasodilation. देखो डॉक्टर तन्मय, जैसे 50S कौन कौन सी ड्रग्स है? मैक्रोलाइट्स वाली एजिथ्रोमाइसिन, ठीक है, एरिथ्रोमाइसिन, क्लेथ्रोमाइसिन, दैट इज ए 50S वाली. 50S सिंथेसिस, प्रोटीन सिंथेसिस, इनहिबिशंस. अमीनोग्लाइकोसाइड्स, दैट इज ए अमी के पास रहते हैं, लाइक द अमीकासीन. जितने भी ये 30S, ये छोटे लोग होते हैं. 30S छोटे छोटे बच्चे अमी के पास रहते हैं, अमीकासीन. That is a vasodilation. So that one we need to remember. That is a vasodilation which is the L-arginine, NO. Now methionine, which is the what? It's a sulfur containing amino acids. Sulfur containing amino acids, and there is a like the trinucleotide, that is a AUG, which is the start codon. Next one, best parameter to assess the adequate brain, that is a burn fluid resuscitation. Best parameter. Now there is in the burn, there is a fluid which is the fluid of the choice, that is a ringer lactate. That is a fluid of choice, that is ringer lactate. Ringer lactate is also, that is a fluid of the choice in the like malnutrition, patient present with malnutrition. रिंगर लैक्टेट के साथ ऐड करते हैं डेक्सट्रोज 5%. ठीक है, दैट इज अ यूरिन आउटपुट और व्हाट? दैट इज अ यूरिन आउटपुट. So that one we need to remember. This is the 2-time NEET PG and FMG repeated questions. Next one, FMT questions, that is a 21 teeth are present at what age? That is a 6 year. What is another term for the lesbianism? This is what? This is the tribadism. Tribadism. Question number 33. What is the action for the superior rectus muscles? That is a elevation, intorsion and the adduction. That is a elevation, intorsion and adduction. There is a muscles and the nerve supply. That one we need to remember. SO4, superior oblique SO4. ठीक है, LR6, rest 3. Lateral rexat, which is supplied by the abduction 6, and the SO4 superior oblique, which is supplied by the fourth cranial nerve, and the rest one which is supplied by the 3. So that one we need to remember. Next one, flaccid bulla with a positive Nikolsky sign. Flaccid bulla with a positive Nikolsky sign seen in what conditions? And then that is a another one conditions where is a bulla you will see, but there will be the negative Nikolsky sign. Negative Nikolsky sign. That negative Nikolsky sign which is the seen in bullous pemphigoid. Bullous pemphigoids. It's a pemphigus vulgaris. It's pemphigus vulgaris. So that one we need to remember. Next conditions, that is a 35, that is vitamin K is requirement for the which reaction? Vitamin K के बारे में everything you need to remember. There is vitamin K dependent factor which is 2, 7, 9, 10. ठीक है, 27,910, 2, 7, 9, 10. Okay. And protein C and protein S. Protein C and protein S. And also you need to remember that is a vitamin K, which is the like the what is the source? That is a source is the gut flora, the gut bacterial floras. That's why in the like the when newborn like the born, then we first that injection we give, that is a vitamin K, because of that gut which is sterile. Okay. Yes, this is the gamma carboxylations. There is a gamma carboxylation of glutamate, that is a vitamin K is requirement. And vitamin K, it's antidote for the warfarin. Warfarin का antidote क्या है? Vitamin K. Heparin का antidote क्या है? What is the antidote for the heparin? Heparin antidote, that is a protamine sulfate. Warfarin is strong one, and that one we need to remember, and that is a purple toe syndrome वगैरह, ये that is a side effect of this one. Okay. Yes. What is the gold standard measure to the GFR? Gold standard. That is a inulin. Why not serum creatinine? Because serum creatinine वो कर देता है, ओवर एस्टिमेशन कर देता है, ओवर एस्टिमेशन ऑफ द GFR, because of that is the absorption which is the like the that is a GFR which is the like the more than inulin, that is the over estimations. Yes, heparin which is the like the monitored by the APTT, and that is also that is a warfarin which is the like the monitored by the PTINR. Next one, what is the most common cause of the oral cancer in India? That is a tobacco. If tobacco is not given in the option, then you can mark the betel nut. Okay, betel nut, supari and all. Okay, Doctor. Next one, what is the major site for the gluconeogenesis? What is the major site for the gluconeogenesis? The major site for the gluconeogenesis, that is a liver. So that one we need to remember. When we are taking the food, liver का cytoplasm, ठीक है? Liver का cytoplasm, that they are asking about the organ. When we are taking the glucose will go goes into the glycolysis, and glycolysis will be the like they make the product which is what? Pyruvate, or pyruvate से convert होगा acetyl CoA. Acetyl CoA will be having the two paths. Either it will goes into the acetyl CoA, that is a Krebs cycles or the TCA cycles, and either it will goes and it will make the like cholesterol. ठीक है, either it make the triglycerides, and these Krebs cycles में से generate होंगे NADPH, and then this NADPH will goes into the what? ETC cycle, और ETC cycle का complex 1 start करते हैं, फिर complex 2 में succinate dehydrogenase, then the cytochrome reductase, then cytochrome oxidase, then ATP synthase वाला, then ATP generate on water generate होता है, final acceptor of the electron, that is oxygen होता है, और ATP generate होता है, जिससे अपनी body work करती है functionally. So that one we need to remember. अरे chill dog, chill. Next one, hand foot mouth disease, which is caused by the hand foot mouth disease, which is the Coxsackie virus. There is a Coxsackie virus, so that one we need to remember. Coxsackie virus. Period of viability in the fetus, the period of viability in the fetus, that is a 28 week. जब भी अपन बात करेंगे, इंडिया की बात करेंगे, यूएसए में, in the USA there is a 22 week. Okay, cephalic index 75 to 80, it indicating what? It's indicating that the it's indicating what? It's a meseticocephalic, that is a skull, that is a European or Chinese का, ठीक है, European or Chinese. Question number 42, that is a pyronidines, that is a belongs to the which class? This is belongs to the anti-malarial, that is a anti-malarial, and which is the like the trigger the what? It's trigger the G6PD deficiency, G6PD deficiency, and G6PD deficiency, it's caused by the what? It causes the hemolytic anemias. G6PD, where is the like the indirect Coombs test is the negative one, and it's X-linked recessive disorders, and which is triggered by the fava beans, anti-malaria drugs, sulfur drugs, and the nitrofurantoins, which is the nitrofurantoins drug of choice of UTI conditions, ठीक है, nitrofurantoins trigger करता है G6PD की deficiency को, which is the trigger the hemolytic anemias, and also it's like the cause the pulmonary fibrosis. Yes, and here you will see the what kind of the bodies? Hinge bodies, Howell-Jolly bodies, hinge bodies and the bite cells, hinge bodies and bite cells you will see in these conditions. Howell-Jolly bodies you will see in the post-splectomies, ठीक है, post-splectomies. Next one, what is the antibody seen in the neonatal lupus? तो neonatal कैसे याद रखोगे? Neonates हमेशा रोता रहता है, रो, so anti रो SSA, और उसको कहता है चुप हो जा, that is a SSA, and the anti रो, that is a neonatal lupus, so that one we need to remember. Yes, Dr. Devas, that is a pulmonary fibrosis which is caused by the methotrexate, which is caused by the nitrofurantoins, which is caused by the amiodarons, which is caused by the that one. Amiodarons हो गया, that is a carmustine also, that is a carmustine also. Bleomycin also, bleomycin, busulfans, and there is a always when we are prescribing these drugs we need to make the baseline investigation, that is chest x-ray में दिख जाएगा pulmonary fibrosis है या नहीं है, ठीक है. रोला जमाना, रोला है ना, रोला. नेक्स्ट वन, एंटीपोर्ट में क्या होता है? दैट इज अ फिजियोलॉजी क्वेश्चंस, बेसिक क्वेश्चंस, दैट इज अ वन सब्सटेंस विल गो एंटर व्हाइल अनदर वन विल लीव्स, ठीक है, क्रॉस वाला, दैट इज एंटीपोर्ट. नेक्स्ट वन इज दिस वन इज द INISET 9 November 2025 questions. The germ tube formation seen in what condition? ठीक है, मेडियस शर्मा देख लेना आप, है ना. No, Dr. Pratik, Howell-Jolly body is less likely you will see in the megaloblastic anemias. Megaloblastic anemias का कब क्लियर है, वहां पर तो मिलेगा hypersegmented neutrophils you will see in that conditions, which is the megaloblastic anemias. Megaloblastic anemias तीन चीजें को सोचना है, folic acid, B12 and the orotic acids, ठीक है, orotic acids. अब folic acid होगा तो neurological symptoms will be not there, also MMA will be the normal, but in the B12 you will see the neurological symptoms. And the orotic acid का क्या हिस्ट्री होगी? orotic acid urea, they will tell you that is a patient present with megaloblastic anemias, these kind of symptom is this, and they will tell you the last line, this is the symptom which is the not like the improving despite of the giving the folic acid and the B12. हो सकता है, बट अपना प्राइमरी एमसीक्यूज, प्राइमरी that things which is the post splectomy, hinge bodies and the hypersegmented neutrophils, that is a clear, ठीक है. हाँ फोटो भी आता है, they will photo in germ tube test, they will give you the photo, this is the candida albicans and they will give you this kind of photo, ठीक है, white white इस तरीके का. I will post this photo. There is a germ tube test, germ tube test, germ tube formations. Best test for the ovarian reserve. This is the high chance of this question in the FMG 28th June. Yes, this is the EMH. Thank you, chill dog, chill dog, chill dog. Best test for the ovarian reserve, that is a antral follicle counts. Now, question number 48. There is a characteristic features of the Crohn's disease. Characteristic features of the Crohn's disease. The Crohn's disease and ulcerative colitis 100% exam questions. इस बार अगर पूछा तो they will ask you the drug of choice. Okay, in the UPSC CMS 2025 they already asked about the drug of choice of the like gist और वो imatinib के बारे में पूछ चुके हैं, ठीक है. तो this time they will ask you this one. Crohn's disease, ulcerative colitis में से there is a drug they will ask you and characteristic features, that is skip lesions. Skip lesions you will see in the Crohn's disease. And also you will see the transmural invasion, ठीक है, transmural invasions. Skip lesions you will see the cobblestone, that is cobblestone appearance, string of pulse appearance. Okay, and another one, its patient will present with ophthalmos ulcers, ठीक है, ophthalmos ulcer के साथ patient will present, ठीक है. Transmural inflammations and the drug of choice, which is the drug of choice in infliximab. That one we need to remember. Infliximab, which is the drug of choice in that conditions, Crohn's disease, okay. And there is a fistula. Fistula is also, which is also associated with the Crohn's disease. Fistula is also associated with the Crohn's disease, and the pseudo polyps and the toxic megacolon and the lead pipe appearance, that is the ulcerative colitis, okay. So that one we need to remember. Next one, sodium concentration in the ORS, reduced ORS. Sodium concentration, this is the 75 millimole per liter. There is a 75 millimole per liter, which is FMG BYQ. Yes. That is a 75, ठीक है. Now folinic acid is antidote for folinic acid. It's antidote for what conditions? The folinic acid, which is the active form of the folic acids, and another one name they can ask. This is the leucovorin. Dr. Royal, I'll tell you, okay. Leucovorin, and it's a antidote for the methotrexate. Methotrexate बारे में everything you need to remember. It's like it's anti-metabolite drugs, and which is used in the cancer and the various conditions, okay. And it's reduce what? It's reduce the DNA synthesis. And it's work in S phase. And it's inhibit the what? THFR. That's why there is a folic acid we need to give in the period, and there is a side effect which is pulmonary fibrosis. That one we need to remember. Now, potassium sparing diuretics that does not cause the gynecomastia. So here is the one drug which is there already, which is the different form. क्या बोल रहे? So PYQ is different down different. So I'll send you this PDF after the finishing of this session. Okay, doc. Potassium sparing diuretics that is does not cause the gynecomastia. So यहाँ पर spironolactone is bahar. This is a drug which is causing the gynecomastia. That is a disco drug. What does a disco mean? there is a digoxin, isoniazide, spironolactone, ketoconazole, another one, estrogen. So that one we need to remember. डिस्को ड्रग्स, ओके, डिस्को ड्रग्स. और डिजोक्सिन के बारे में एक और ध्यान रखना है, देयर इज अ साइड इफेक्ट विच इज द येलो विजन, विच इज द वी लाइक द रेगुलरली हम भूल जाते हैं इस चीज को, ठीक है. सो दैट वन वी नीड टू रिमेंबर. दिस इज द पोटेशियम स्पेयरिंग डायूरेटिक्स दैट डज नॉट कॉज दैट गायनेकोमेसिया, दैट इज एमिलोराइड्स, दैट इज एमिलोराइड्स. and amyloids which is the also drug of choice in one conditions. Can you guess this disorder? Okay, I am giving you the that is symptoms. Yes, cimetidine which is the expire होगी ना वो तो. Cimetidine is also like cause the gynecomastia. Drug of choice, it's amyloids which is also drug of choice. One disease where is the related to the kidney की 4 disorder होते हैं. इनमें से options मैं दे देता हूँ, Bartter, Gitelman, that is the Liddle, or the this one Fanconi anemias, ठीक है. इनमें से एक को बताना है. दिस इज द डिसऑर्डर विच इज द डिसऑर्डर ऑफ द लाइक द कलेक्टिंग डक्ट वेयर पेशेंट विल प्रेजेंट विद द बीपी के साथ, दैट इज अ हाई, दैट इज ब्लड प्रेशर इज सो मच हाई, एंड द ऑटोसोमल डोमिनेंट डिसऑर्डर मेटाबॉलिक एल्कोलोसिस कंडीशन. यस, इट इज दैट इज अ लीडल सिंड्रोम, दैट इज अ लीडल सिंड्रोम. सो लीडल सिंड्रोम के बारे में आपको क्या क्या चीजें ध्यान रखनी. दिस इज द मेटाबॉलिक एल्कोलोसिस, एंड दिस इज द व्हाट, हमेशा बीपी हाई, देयर इज अ हाइपरटेंशन, बीपी इज द हाई, एंड इट्स अ डिसऑर्डर ऑफ द डीसीटी, okay, disorder of the DCT. And that one another things, because this is the higher chance of the they will ask you the either they will ask you Bartter, Gitelman, or the this one Liddle syndromes. तो ये आपको ध्यान रखना है, ठीक है. DC that is a metabolic alkalosis, BP is the high, collecting ducts, and there is a drug of choice which amyloids is the drug of choice. So that one we need to remember about the Liddle syndromes or the Liddle syndrome. It is autosomal dominant disorder. It's autosomal dominant. तो कैसे याद रखोगे, लड़ाई करने के लिए कलेक्ट होना पड़ता है. No, it's disorder, not a disorder of the DCT. It's a disorder of the collecting ducts. Sorry, okay, my mistakes. That is a Liddle syndrome, which is the like the it is a disorder of the collecting ducts, and it's a autosomal dominant disorder, metabolic alkalosis condition, and लड़ाई करने के लिए कलेक्ट होना पड़ता है, and dominant वे में autosomal dominant कलेक्ट होना पड़ता है, means collecting duct का disorders, and this is the BP is the so much high, क्योंकि लड़ाई करेंगे BP हाई हो जाती है. So the only one disorders of the kidney वाला है Bartter, Gitelman, Fanconi, इनमें से only one disorder which is the like the where is the BP is the, they will give you the history, they will give in the history, they will give you the like history in the BP is the so much high hypertensive conditions, and the autosomal dominant condition, metabolic alkalosis conditions. That is a Liddle syndrome. Only one condition which is the metabolic acidosis condition, that is Fanconi anemia, which is the PCT. तो कैसे याद रखोगे, Fanconi anemia इट्स अ डिसऑर्डर ऑफ PCT. कैसे याद रखोगे, फैन को पास रखना पड़ता है तभी हवा आएगी, ठीक है. Fanconi anemia. No class will be like next 50 minutes more, ठीक है, 50 minutes more. Gentleman, जेंटलमैन को कैसे याद रखोगे, जेंटलमैन दूर तक जाता है, तो जेंटलमैन दूर तक जाता है मींस दैट इज अ जेंटलमैन, इट्स डिसऑर्डर ऑफ द डीसीडी. जेंटलमैन विच इज द जेंटलमैन विच इज डिसऑर्डर ऑफ द डीसीडी, और जेंटलमैन दूर तक जाएगा तो ब्रेन का यूज करेगा. हाइपोमैग्नीसीमिया, देयर इज द ओनली डिसऑर्डर वेयर यू विल सी द हाइपोमैग्नीसीमिया, जेंटलमैन. और बार्टर के बारे में क्या याद रखना है, जो बार थिक बार में जब बार में जाते हो तो थिक लूप में क्या जूस, एल्कलाइन जूस पीते हैं, मींस व्हाट, मेटाबॉलिक एल्कोलोसिस कंडीशन, एंड दैट्स अ थिक लूप ऑफ द हेनले, एंड hypocalcemia, but magnesium will be the normal. Hypocalcemia can be the seen in gentlemen, but there is a magnesium will be the normal in the Bartter but low in the gentleman. So that one we need to remember. ठीक है. नेक्स्ट वन, there is hyperthyroidism condition where is a lid leg sign किस में मिलेगा, there is a one graph, there is a need, there is sign which is the hyperthyroidism में मिलता है lid leg sign, that is known as a one graph sign, FMGPY, which is already asked. In the hanging autopsy, which cavity is opened first, which cavity we open first in the hanging wale? Yes, it's a cranial one. We open the cranial cavity, we open in the hanging autopsy. Next one, that is a CEA used to follow up the which type of cancer, that is colorectal carcinomas. So that one we need to remember, colorectal carcinomas. And in the colorectal carcinoma, apple core appearance you will see, and also C, there is a CA 15, 19, 125. What does mean? Breast में 15 CA, 15 in the breast, 19 and the, that is also seen in pancreas and the colorectal, 19, and 125 in the serous cystoadenoma of the serous cystoadenocarcinoma of the ovary. Okay. ठीक है. Tuberculosis of the phalanges, it is called what? It's called the spina ventosa. Now 56, most common cause of the congenital adrenal hyperplasia enzyme deficiency. That one we need to remember. That is a 21 hydroxylase deficiency. Next one, most common organism which is the cause the osteomyelitis. Organ osteomyelitis कौन सा है organ? जल्दी आंसर बताते रहो. There is a, so we can finish it as much as we can in the fast manner. Yes, it's a step, or yes, it's a step, or yes. Ludlem agar used for the step, or yes, that one we need to remember. Okay. Next, most common benign ovarian tumors. One line MCQs. There is a serous cystoadenoma. What is the most common site for peptic ulcer? What is the most common site for peptic ulcer? That is the first part of the duodenum. That is a D1. D1 we need to remember. The first part of duodenum, that is the most common site. Yes, Dr. Subham Bhagat. Now, most common cause of the nephrotic syndrome in the children. Children में कहीं पर पाया children कैसे होते चिन्ह से कैसे minimal. That is a minimal. So it is a minimal chain disease. So it's a minimal chain disease. तो चिन्ह से बच्चे छोटे बच्चे. What is the tumor marker for the hepatocellular carcinoma? Which is, because it is already asked in the previous one, it is a alpha fetoproteins also tumor marker for the yolk sac tumor, where you will see the cellular dual bodies. ठीक है, cellular dual bodies, alpha fetoproteins. So that one we need to remember. Now tumor marker सारे देख लो एक बार. Alpha fetoproteins, hepatocellular carcinoma. It is also increasing the yolk sac tumors, where you will see cellular dual bodies. Okay, cellular dual body, alpha fetoproteins, and the most specific marker for the yolk sac tumor. Choriocarcinoma, C आया तो it's a beta SCG. C choriocarcinoma, C and a beta SCG. That is also, there is a C. ठीक है, and it's increase in what? Beta SCG. It's increase in hydatidiform mole. Now hydatidiform mole, beta SCG. That one we need to remember. Testicular seminoma, there is a PLAP, that one we need to remember, and beta ICG, that is not that much specific as the PLAP is specific. And here is the alpha fetoprotein, which is the not increased in the pure seminoma. In the pure seminoma, where what kind of appearance you will see? The fried egg appearance. ठीक है, fried egg appearance. Doc 30 to 40 MCQs. ठीक है. Now prostate is important one, which is the FMG Jain 2025 questions, where they ask there is a lots of they give the history, but there was the only buzzword, where is the PSA level was increased. It is indicating what? Prostate cancer. It is a prostate cancer, which is screening and the follow up, which is the useful for the screening and follow up. ठीक है. Calcitonin we already discussed, which is the calcitonin, which is the marker for the medullary thyroid carcinoma, which is also associated with the amyloidosis. ठीक है, amyloidosis, and it's a secret from the parafollicular C cells. Now papillary thyroid carcinoma, where is a thyroglobulins is there, and also you will see the what kind of mutation? BRAF mutation. You will see the BRAF mutation, and it's a most common thyroid carcinoma. Yes, Dr. Disling. ठीक है. Next one, follicular thyroid carcinoma. Follicular thyroid carcinoma, there is thyroglobulin. It's a recurrent marker for this one. Now ovarian epithelial carcinoma, the CA 125, I told you that is a 15, 15, 99 and the 125. So 99, that is a pancreatic adenocarcinoma and colorectal carcinomas, and cholangiocarcinoma, where you will see the also there is a CA 99. Next one, colorectal cancer, there is a CEA. ठीक है, it's not screening, it's for the follow up. ठीक है. Gastric cancer, there is a CEA and CA 99. Breast cancer, there is a 15 3, and also you will see the another one, that BRCA1 and BRCA2. BRCA2 most likely will be in the male breast cancers, which is associated with Klinefelter syndrome, and BRCA1, which is the female, which is associated with the female. So that one we need to remember. Now neuroblastoma, we have the VMA and the VMN HVA, you will see the positive in that conditions, and also you need to remember there is a NMYC mutation you will see. Can you tell me where we studied the CMYC mutation? CMYC you will see in Burkitt lymphoma. Okay. Yes, Dr. Sahab, yes. Correct, Dr. Pratik, correct. Yeah, it's a Burkitt lymphoma. Pheochromocytoma, that is a metanephrine VMA level, you will see in the urinary VMA levels, and the 24 hours metanephrine levels you will see in the that pheocytochroma. In the pheocytochroma, everything you need to remember about these things. What is the investigation of choice, and what is a what kind of scan we use? What is the investigation of choice in this condition? The investigation of choice is the MRI scan you use, that is a MIBG scan. Okay, 24 hours metanephrine we use for this one, but the investigation of choice is still MRI. And there is a what is not a part of triad? There is a hypertension, which is not a part of triad of the pheocytochroma, and pheocytochroma which is associated with the MEN2 syndrome. Okay, MEN2 is also known as a Sippel syndrome. What will be the triad of the pheocytochroma? The triad will be the like the sweating palpitations and the sweating palpitation and headache you will see. Okay, but hypertension will be the not a part of triad. Multiple myeloma, M proteins and Ben-Jones protein in the urine. That is Ben-Jones protein, which is already asked. Ben-Jones protein, that is a urine remain, and it's a multiple myeloma. You need to remember everything. That is a serum electrophoresis, which is the gold standard for the multiple myeloma, where you will see those two cells, Mohr cells and Flem cells. And another one, Russell body and Dutcher bodies, you will see Dutcher body will be the intranuclear and intracytoplasm will be the Russell bodies in that conditions. Okay. What is the drug of choice of multiple myeloma? What is the drug of choice of multiple myeloma? Rolex formation, YAM spike, yes. Rolex formation also you will see in that multiple myeloma. Yes, bortezomib. Bortezomib is a drug of choice for the multiple myeloma. Which they can ask anytime. और pheocytochroma की you already know that pre-operative, intraoperative and post-operative. एक बार फिर से रिवाइज कर लेते हैं. Pre-operative you will see the phenoxybenzamin. Intraoperative you will see the what? Phentolamine. And post-operative you will see the labetalol, that is beta blocker. Never give the beta blocker in the like earlier manner. Bortezomib याद रखना, ठीक है. Next one, carcinoid tumors, 5HIA, and there will be in the carcinoid tumors they will give you the two buzzword. That is what that will be the two buzzword. That is a flushing and the diarrhea. Flushing and diarrhea, that is a carcinoid. Now small cell lung carcinoma, that is NSC, and which is the small cell, that is lung carcinoma, which is aggressive in the manner. Okay, aggressive in manner. Next one, smoking cell carcinoma of the ovary, that is a SCC antigen you will see of the ovary, or it can be the cervix. That is a SCC antigen will be the always there, because this is the like that they are monitoring the recurrence of that one. squamous cell carcinoma. And here we need to remember there is a, in the pathological smear, you will see the what kind of pulse? The keratin pulse. The keratin pulse, that one we need to remember. Next one, melanoma, S100 is positive and S100 is also positive in the LCH. What does mean of LCH? Langerhans cell histiocytosis. Langerhans cell histiocytosis. That marker will be the present in also in the melanoma and also will be present in the LCH. Malignant melanoma, you need to remember about the ABCD. Out of this one, asymmetry and border, that is all the things, but the diameter you need to remember. Diameter, how much? More than 6 mm. More than 6 mm. Now, what is the most common cause of postpartum hemorrhage? What is the most common cause of postpartum hemorrhage? That is a uterine atony. Uterine atomy. ठीक है डॉक्टर साहब. Next one, drug causing the gray baby syndromes. The drug causing which is the gray baby syndrome, which is the chloramphenicol. Drug causing which is the red man syndrome, which is the drug causing which is the red man vancomycin. Drug causing the blue man इससे amiodarone. Amiodarone के 3-4 साइड इफेक्ट हो गए. What can be there? That is a blue man syndrome. Okay. Another one side effect. There is a hypothyroidism, hyper, both. Hyperthyroidism, both. Okay. And another one, that one we need to remember, that is a pulmonary fibrosis. Red secretion, that is orange or red secretion, orange secretion, there is a rifampicin. Rifampicin. Gray baby syndrome, chloramphenicol. Gray baby syndrome, chloramphenicol. Reed-Easternberg cells, these are the like the seen in what conditions? These are the seen in Hodgkin's lymphoma. These are the seen in Hodgkin's lymphoma. Okay, doctor. Next one, most common site for ectopic pregnancy. That 95%, that is a ectopic pregnancy most likely implemented at the ampulla. That is a ampulla of the fallopian tubes. Now, what is the drug of choice for the status epilepticus? All the epilepsy drug of choice we need to remember. At least we need to remember that is seizures. कौन से वाले? Absence वाले seizure. Absence seizures, ethosuximide. Typical वाले में ethosuximide. Atypical वाला में valproate. So that one we need to remember. That is 66. That is a drug of choice. That is a lorazepam. Lorazepam, it is a drug of choice for the status epilepticus. The focal seizures, that is a drug of choice which is carbamazepine. So that one we need to. If carbamazepine is not available, then we will give the lamotrigine and levacitram. But lamotrigine, levacitram most likely we give in the pregnancy conditions. Okay? Pregnancy conditions. Now, focal seizures with the impaired awareness, that is a carbamazepine we will give, and we will avoid the lamotrigine. Okay? So that one we need to remember. Now, GTCS, that is a drug of choice which is sodium valproate. That is sodium valproate. And valproate we need to avoid in the pregnancy because it's caused the spina bifida. But if the patient is already having the history of the like the taking the valproate, or then we need to add the folic acid. We need to add the that is folic acid. ठीक है भाई, drug of choice मान लो. Okay. Absence seizure, that is a typical wale absence seizures, that is ethosuximide is drug of choice. But in the, this is the expensive drug which is available in USA. India is very less amount of the available. So there is a क्या बोलते हैं, alternative we use the valproate. If they are clearly written, this is not a typical absence seizure. This is the atypical absence seizure. Then drug of choice is sodium valproate. Then if there is a typical absence seizure, then ethosuximide. So that one things, that one we need to remember. Flumazenil is the antidote for the what? Flumazenil for benzodiazepine. Fomepizole for the alcohol wale. Myoclonus seizures valproate, atonic seizures for the valproate. Now, यहाँ पर आती है मेन फंडा. Then infantile spasm, where is drug of choice is the ACTH. ठीक है, ACTH. But if there is that, they are telling that patient present infantile spasm with the tuberous sclerosis. Then drug of choice is vigabatrin. With tuberous sclerosis. Okay. If you don't know what is the tuberous sclerosis is very, you will see the angiofibromas, where the patient will present with the sago green patch, and this is the like congenital disorder where the TSC1 gene mutation which is present on the chromosome number 9 and TSC2 which is present on the chromosome number 16. Okay? That is tuberous sclerosis, and tuberous sclerosis with infantile spasm, there is a drug of choice which is that is a vigabatrin. So that one we need to remember. Now febrile seizures, there is a, we can give the, in the febrile seizures which is the, like the not that much complex, so we will give that diazepam. Okay, diazepam, because these are the self limiting seizures. Okay, now status epilepticus, we give that one, there is a lorazepam. If lorazepam is not they're not there, then we will give the diazepam and the midazolam. Okay, refractive status epilepticus, we will give the propofol infusions. Okay, milky infusions. And eclampsia seizures, we will give the MGSO4. Okay, or the severe pre-eclampsia, where is the risk of that eclampsia, then we will give the magnesium sulfate. Now question number 60. Yeah, propofol also day care में. Question number 67. Most common inherited bleeding disorders. That is a von Willebrand disease. Most common cause of death in MI. That is arrhythmia. Arrhythmia is the most common cause of the death in the MI. Now MI का एक और क्वेश्चन आता है, MI post MI के बाद फीवर आया. What is the syndrome name? Post MI fever. Post MI fever. It's caused the what disease? The disease name which is start with the D. Can you tell me? Post MI के बाद fever. The most common cause of the death in MI, it's yes, arrhythmia is okay. बताओ. Yes, it's a Dressler syndrome. Most common cause of upper GI bleed. Now एक चीज मैं बता देता हूँ, there is upper GI bleed or the lower GI bleed, there is a something boundary, there is a ligament of teres, the ligament teres above the upper GI bleed. If there is lower GI bleeds, then there is a lower, it's below to the ligament of teres. In the upper GI bleeds, their patient will present with the what? Hematochezia or hematopsis. Hematosis. There is a bleeding, blood के साथ में vomiting. ठीक है? Vomiting with blood. If there is a, like the fecal material साथ में there is a blood, there is a hematochezia. So hematochezia, it's a lower, there is a lower GI bleeds, and the hematosis, there is a upper GI bleeds. And what is the most common cause? That is peptic ulcer disease. Peptic ulcer disease, that is a most common cause for the upper GI bleeds. What is the most common cause of lower GI bleeds? What is the most common cause of lower GI bleed? That is diverticulosis. Now, can you tell me there is a diverticulosis or colitis? There is a someone in between them. There is a one that is disease where is a appearance which is sawtooth appearance. Sawtooth appearance seen in what conditions? Sawtooth appearance, तीन चीज आपको ध्यान रखनी है. If they are asking regarding the sawtooth appearance in the ECG, that is atrial flutter. If there is a sawtooth appearance in the like the sleep cycle वाला sleep wave में, that is a REM. And here you will see the diverticulosis. Where is diverticulosis में you will see the sawtooth appearance. ठीक है? Culosis. Yes, Dr. Saab, yes, correct. Which is the organism which is the causing the pseudomembranous enterocolitis. And this is the cause what? This is the cause antibiotic associated diarrhea. What antibiotic? There is a clindamycin. The drug which is the clindamycin, and that there is a drug of choice for the drug induced the diarrhea or pseudomembranous enterocolitis. There is drug of choice which is the vancomycin. Yes, it is a Clostridium difficile. That is a Clostridium difficile. Great. हाँ, lichen planus में भी you will see the sawtooth appearance, Dr. Aruna, Dr. Tanmay, yes, correct. But आपने को तीन चीजें याद रखनी है. So it is a Clostridium difficile. It's Clostridium difficile. What is the most common extracranial solid tumors in the children that we discussed? That is a neuroblastoma. 73 number questions. What is the most common type of the renal stone? That is a calcium oxalate. Okay, Doctor Sir? Yes, Doctor. Medicine 1, 2, 3, 4. I will send you the PDF after this finishing this session. Yes, which stone is associated with the proteus infection? That is a steroid stone. That is steroid stone, which is already asked in NEET PG and 9A set. Proteus infections. They gave the case of this one. Next one. What is the shape of the cystine? The crystal shape. FMG questions. They gave this photo of this shape. The benzene or a hexagonal shape. The benzene or hexagonal shapes you will see in the cystine. Okay. Now OCPs it protects against the which gynecological cancer? This is the FMG Jan 2025 questions. This is endometrial cancers. Against the endometrial cancer, it is OCP which is the protects endometrial cancers. Okay. Endometrial cancer. Yes, great. Next one. The contraceptives, that is contraceptive which is contraindicated during the lactation. लैक्टेशन में कौन सी वाली कॉन्ट्राइंडिकेटेड होती है? विच वन इज कॉन्ट्राइंडिकेटेड? यस, दिस इज द COCPs, combined OCPs, which is contraindicated during the lactations. Now 78, which is we already discussed, the inability to write, it's called agraphia. That is agraphia. Now अब आपका आंसर आएगा, that is antibiotic which is the having the greatest cochleotoxic effect. Cochleotoxic effect, which one is the neomycin have the cochleotoxic effect. Now vestibulotoxics, that is a streptomycin. Both are the FMG PYQ. Multiple time they ask these questions. Cochleotoxic, neomycin. The vestibulotoxic, that is streptomycin. Now what is urine output, which is the ideal urine output in the burn patient resuscitation? Burn patient, I told you that fluid of choice is there, that is a ringer lactate. Fluid of choice is ringer lactate. And what is the like the immediate cause of the death? That is the choking वगैरह से immediate death हो सकती है. And the earliest death, that is early death होती है, that is a hypovolemic shock. And late death due to the septic shock. Due to the septic shock. There is a risk of infection of what? Pseudomonas का infection है का risk है, ठीक है? So that one we need to remember. That is 0.5 to 1 milligram per kg per hour. And here is the risk of what? Pseudomonas, which shows the blue-green colonies. Pseudomonas, blue-green colonies. The number of primary teeth by the 2.5 to 3 years, that is a 20 teeth, which is FMT questions. Once a time they ask this one. The sexual gratification, which is the wearing the opposite sex clothes, it's called what? It's a eonism, which is the FMG Jan 2026 question, which you already asked. Eonism or transvestism. In the option they give the transvestism. Na? Yes, silver nitrate 1% we use, Dr. Akhilesh Gupta. ठीक है. Next one, substance used to measure the renal plasma flow. That is a para-aminohippuric acids, that is pH. That is pH. Okay, so that one we need to remember about the pH, which is used to measure the renal plasma flow, because it's not observed. Most likely observed, that is a water, which is the most likely it will be observed in the PCD. There is a water and that is glucose. So here is the answer is the pH. They will not observe. What is the most likely antibody which is associated with ulcerative colitis? What is the antibody which is associated with ulcerative colitis? This is the P Anka. This is the PM ka. So that one we need to remember. What is the total osmolarity reduced in RS? ORS? That is a 245 millimole per liter. What is the chloride concentration? That is 65. Methotrexate and inhibit which enzyme? We already discussed. That is a DHFR, dihydrofolate reductase inhibit. Next one, the potassium sparing diuretics which is acting on innate channels. Innate channel. Innate पे वो थोड़ी करती है. That is amylorides. That one we need to remember. Next one, the potassium sparing diuretics which is the fewer anti-androgen effect than the spironolactone. This is the aprenolone. Next one, 91, which is we already discussed. That is a mutton fat keratic precipitation, which indicating what? Granulomatous uveitis and iridocyclitis. Next one, hyperthyroidism sign, which is show the absence of the blinking. That is a stale walk sign. मतलब ऐसे हो गया, एकदम स्टील हो गया. Next one, there is a hyperthyroidism sign which is showing the visible sclera. कौन दिखाती? Darling. So it's a Dalrymple sign. Next one, hyperthyroidism sign which is showing the failure to converse. That is a failure to converse. That is a Moebius. Sign. Now, what is a classical disease which is causing the trismus? That is a tetanus, which is caused by Clostridium tetani. Now, can you tell me what is the media used for the Clostridium tetani? Media. कौन सा वाला? रॉबर्टसन वाला, RC BN. Robertson Cook media na. Now facial nerve, that is a branch supplied to the lower lip muscles. Yes, that is a marginal mandibular branch. Next one, anatomical snub box. That one we need to remember. That one we need to remember. The medial boundary, which is by the medial boundary. This is by the extensor pollicis longus, EPL. इसमें कौन सी artery in the anatomical snub box? What kind of artery will be involved in that condition? Artery. That is a radial artery, not radial nerve. What kind of, they will give you the kind of the history, that overstretch of the, that is a overstretch of the hand, or the tenderness or overstretched hand. This is the most likely associated with scapular fractures. In the scapular fractures, where is the, what kind of the, we use that glass, that is split, that is glass holding. Glass holding. Saturday night palsy, that is a radial, not artery, radial nerve. यहाँ पर मैं radial artery की बात कर रहा हूँ. Medial EPL, we already discussed this one, and the lateral anterior, that is a abductor pollicis longus. ठीक है, abductor pollicis longus. Now, which is the joint which is responsible for supination and pronation? Supination. That is a no joint one. Supination pronation. And this is called a pivot joints. It's a radio ulnar. Pivot wala. Radio, that is superior inferior radio ulnar joints. That is also known as a pivot joint. First heart sound, it's a coincidence in which phase there is isovolumetric contraction. Isovolumetric contraction. That one we need to remember. Now, liver cell की कौन सी enteric organism, that is a cells, that is a macrophage, that is a cover cells. Now, liver की cover cells, that is brain की microglia, lungs की that is a dust cell, that is alveolar macrophage. बोन की ओस्टियोक्लास्ट, नॉट ब्लास्ट, ठीक है, इट्स क्लास्ट, इट्स ए स्किन की लैंगरहैंस सेल्स, कनेक्टिव टिश्यूज दैट इज हिस्टियोसाइट्स, दैट इज किडनी mesangial cells, placenta, that is a, you need to remember, this is the FMG PYQ, Hofbauer cells, that is a Hofbauer cells, that is a placenta, that one we need to remember. Now this is the very important one, they can repeat these questions, that is a marker of the intestinal inflammations. Intestinal inflammations, what is a marker? Yes, this is the fecal lactopharynx. Fecal lactopharynx, that one we need to remember. Next one, sterilized agent for the heat sensitive endoscope, that is a glutaride aldehyde. Glutaride aldehyde, this is the FMG PYQ. Dimorphic fungus which is involving that what subcutaneous tissues. Dimorphic fungi की कहीं भी बात करें, that is a Sporothrix Zichenski, ठीक है, and it's cause what? It's cause the Rose Gardner disease. Rose Gardner disease. Mother of food is different one. This is the Eumycetoma and all. That is a, not caused by the only bacteria. That is also caused by the fungi. If bacteria, then yellow that is a क्या बोलते हैं इसको, yellow discharge. If there is a black discharge, then it's caused by the fungal. This is the also question asked in FMG Gen 2026. They gave this one is a black something ऐसा कुछ हो गया, and what treatment you will give? Antibiotic, antifungal we will give. Now, that is a bacterial component which is responsible for the sepsis, that is a LPS, lipopolysaccharides. Drug which is the like the decreasing the mortality of the heart failure. This was not actual questions. Actual questions ये था, which of the following drug does not cause the heart failures. उसमें आंसर था that is digoxin. Digoxin does not cause heart failure. That is, it does not reduce mortality in heart failure. Which is the decrease the mortality, that is a metoprolol, and metoprolol which is first line for the atrial fibrillations. Now first line ATD, that is drug used in the intensive phase for the pleural TB. What is the first line? That is a ethambutol, ठीक है, ethambutol. Next, hand washing in the COVID prevention belong to the which prevention? Hand washing. Can you tell me this one? And I'm wearing this specs. What kind of prevention is this one? I'm wearing this specs. What kind of that prevention? I'm washing the hand. Metoprolol is the good one. Practically, Dr. Salma, the Salam. Hand washing in the COVID, that is a prevention. What kind of the level? That is a primary prevention. That is a primary prevention. And the wearing the specs, that is a tertiary. Wearing the specs, that is a tertiary. Because disability is the limitations. Okay? Yes. Tobacco control laws that prevent the disease in the community, which is the, it's a primordial or that is primary. It's a primordial. It's a primordial. That is tobacco control laws in the like the tobacco awareness in the school. This is also primordial. ठीक है? Because there is the no respecter. ठीक है? Mosquito net, there is a primary, because risk factor is there. Screening, any kind of the screening, that is a secondary. Like there is a normal person going to the take the take the screening of the what, hypertension and diabetes, and in the previous history there his father is died because of the hypertension. That is a secondary. Yes. Child with a short statues but normal bone age, parental normal bone age, and the parents height patterns. It is what? It's familial short statures. Familial short statures. Now this one we already discussed, the fluid of the choice shock with the severe acute malnutrition. Okay. Now what is the parameter for the acute malnutrition? Severe acute malnutrition. That patient will be present with a wasting, and there will be the VA. What is a VA? In the acute malnutrition and chronic malnutrition, there is a something parameter. There is a weight for height. There is a weight for height. There is a acute malnutrition. अब और कैसे याद रखोगे? आपने किसी की तारीफ की, वाह तुम तो बहुत अच्छे इंसान हो, ठीक है, दैट इज अ वेस्टिंग, दैट वेंट इनटू द वेस्टिंग, कोई भी याद नहीं रखेगा, ठीक है। और एक होता है क्रॉनिक malnutrition. In the chronic malnutrition, लाइक आपको कोई लड़की अच्छी लगी या कोई लड़का अच्छा लगा, आपने उसके लिए एफर्ट मारे, मतलब लॉन्ग टाइम तक, दैट इज क्रॉनिक टाइम। क्यों, किस लिए एफर्ट मारे? हाँ बुलवाने के लिए, हाइट फॉर एज, हाँ बुलवाने के लिए हाइट। तो आपने क्या क्या किया? हाँ बुलवाने के लिए उसने आपने स्टंट लगाए, तो स्टंट लगाए, सो स्टंटिंग यू विल सी इन द क्रॉनिक malnutrition. सो स्टंटिंग you will see in the chronic malnutritions. Acute malnutrition, that is a VA, wait for height, that is a wasting. Yes, correct. Great. So fluid of choice and shock in the severe, there is a severe acute malnutrition we discussed, that is a ringer lactant and the 5% dextrose. Now continuous drooling of the saliva, respiratory distress with the newborn suggestive what? The continuous drooling, respiratory distress, and there is a nasogastric tube which is the like a coiled above side, and which is the contraindicated in this condition. There is a tracheoesophageal fistula. So that one we need to remember. Question number 1110. Okay, Dr. Saab. Now another one condition where the patient with present with like the जो nasogastric tube है वो thorax में जाकर के thorax में दिख रही है, that's the condition of what? There is a congenital diaphragmatic hernia where is big and mass ventilation is the contraindicated, but in that tube you will see coiled in the thorax, scaphoid abdomen. Next one, steroid response nephrotic syndromes. Steroid response nephrotic syndrome in child most likely minimal changes. Minimal छोटे बच्चे, that is a child आते ही कहीं पर भी, that is minimal change. Stage of that is a shock which is the like the where urine output start decreasing, that is a moderate type of the shock. This is the already FMG PYQ. Okay, Dr. Saab? Great. Next one, the first lymph node which is involved in the left testicular tumors. This is the para-aortic lymph node. That is a para-aortic lymph node. That one we need to remember. Next one, muscle, that is invasive bladder, that is a cancer which is best management is by the radical cystoprostatectomy. Now there is only 30-40 MCQs left. We will do in the fast manner. Okay, we will do in the fast manner, no worries. Now BRCA1 and BRCA2 mutation which is the not a testing routinely indicating what? It's in the woman which is the present with the breast cancer is diagnosed after the 50 years. Okay. Now what is a sure sign? The wound dehiscence after the laparotomies. The wound dehiscence we will do with the help of the Bogota bags. And there is a what is a sure sign? You will see the what? There is a copious serogenous discharge. There is a FMG PYK, that one we need to remember. Next one, there is a preferred modern treatment for the varicose vein. That is a radiofrequency ablation. And what investigation we will do? We will do the USG Doppler. Now, which type of the pelvic which is associated with the recurrent hernias? That is a टॉल होना चाहिए, narrow, that is a tall and narrow, which is the associated with the recurrent hernia. चिल मारो चिल, कोई नहीं, चलता रहता है, that's the life. Next one, there is a severe abdominal pain radiating to the back. Hypertensive patients with the CT finding suggest what? Severe pain which is radiating to the back side. There is a tennis ball appearance and there is aortic dissection. There is a aortic dissections. Pain which is radiating to the shoulder, that is MI. Okay, that is MI. A pain which is the relief by the forwarding band, that is acute pancreatitis. That is acute pancreatitis. Next one, investigation of choice for the brown tumors in the hyperparathyroidism, that is a technetium 99 system EB scan. Technetium 99 system EB scan. And Bacchus diverticulum क्या होता है? Technetium 99 per technate. ठीक है, MIBG in few cytochroma. That is a few cytochroma MIBG. Few cytochroma MIBG. That Bacchus diverticulum, which is a true diverticulum, where is a two rule of the 2% वाला, ठीक है, 2 years में. That is a the technetium 99 per technate. That is in Bacchus diverticulum. So that one we need to remember. Now swelling along the lower anterior border of the SGM, which arise from the brachial cleft of the remnant. Which one? This is the second brachial cleft. Now, which is the contraindicated for the venous applications? It is a prematurity of the fetus. Next one, 124. That uterus which immediately after the delivery lies at what? It's at the level of the umbilicus. At the level of the umbilicus. That one we need to remember. Yes, Dr. Saab. Correct. Next one. There is a breastfeeding after the normal delivery should be begun within the 1 hour. The breastfeeding which is contraindicated in the classical galactosemias, whereas the Galput is the enzyme deficiency. And what kind of cataract you will see? Oil drop cataract. And this cataract is due to the galactosols. It's due to the galactosol deposition. Like the sorbitol deposition you will see in the diabetes mellitus, where is the you will see the Snowflake cataract. Okay, Snowflake cataract. Next one, the sequence order of the lochia का sequence. There is a RSA का खून खराबा. There is a RSA. There is a rubra, serosa and alba. There is a lochia. There is a lochia sequence. That one we need to remember. There is a RSA. Now motile trophozoites in the foul smelling vaginal discharge. That's showing what? That is a trichomoniasis. There is strawberry vagina you will see. Okay, ovarian drilling we use for the PCOS or PMOS. दोनों एक ही चीज है, ठीक है. Ovarian drilling we do for the PMS. There is a that one we need to remember. RSA एक और भी चीज होती है ना. That is okay. Now blastocyst which is splitting at the day of the 9 to 13 day. That is at what? Monochorionic, monoamniotic twins. Now psoriasis vulgaris, which is characterized by the what? 2-3 things. That one we need to remember. One. This one is silvery plaque scales, and you will see the auspicious sign, Nikolsky positive signs. You will see in that conditions, and also you will see the what? This line was written in the FMG exam. Micaceous scaly and the nail pittings. Okay, nail pittings. Okay, micaceous, that is scaly, and you will see the Munro microapsis, not Porteus. Porteus you will see the mycosis fungoidesis. Yes. Pradhan Mantri ovarian syndrome Yojana. 132. Painful dermoidal vascular lesions on the trunk which are caused by the herpes zoster, which is also known as Sigel's. Okay, Sigel's. Next one, itchy wrist lesions and oral mucosa which is involved, which is suggesting of what? There is a lichen planus. planus, lichen planus, where you will see the VKM strias. ठीक है, VKM stria. Cauliflower shape, it's not condyle lata, it's acuminata. It's that the cauliflower like the verge, the squamous cells. There is an homosexual male which is treated by the, it's treated by the chemoradiations. Okay, most important risk factor for the acute mastitis. That is a most, what is the most common risk factor for the acute mastitis? That is a cracked nipples. There is a cracked nipples. That one we need to remember. This is the PYQ which is already asked. Next one, hypertensive pregnant women at the 34 week. First investigation, what we will do? We will do the urine dipstick pattern test. Okay, urine dipstick. We will do the urine dipstick. Next one, best parameters to assessment of gestational age. That is a crown rump range. Crown rump range. Best management to prevent the recurrence of the endometrioma. That is a cystectomy. Most common indirect cause of the maternal mortality. Indirect, not direct. Please read carefully that questions. That is indirect. So indirect, that is a anemia. What is a, that is a fracture of the clavicle. The facilitated labor is called, it's a clidotomy. That is a clidotomy. So that one we need to remember, clidotomy. Now synergic muscles of the right lateral rectus. Right, this one is my right lateral rectus. So it will be the, इसका movement क्या इस side है ना, so it will be the that is left medial rectus. This one right lateral rectus, then it will be the left medial rectus, and for this one left lateral rectus. For this one will be the right medial rectus. So that one we need to remember. Bitemporal heminopia, it's due to the optic chiasma. There is a optic chiasma, bitemporal heminopia. So that one we need to remember. And this is a condition which is seen in like the prolactinoma or इस conditions में, ठीक है? Opposite हो जाएगा. Yes, correct. Next one, improved the near vision with the nuclear sclerosis. It indicating what? It's index myopia. Or improving the vision, which is like ये कोई page है. Page now I am looking from this page, then my vision is improved. That pinpoint that visions, that is improved. That is an index myopia. That is index myopia. Now what is the additional treatment for amblyopia after the spectacles? Like I have the, मेरे को amblyopia, ठीक है, amblyopia. I have the anisometric amblyopia. Like the इसके अंदर ये I have this lazy eye, the left eye. This is the lazy eye. तो इन द मतलब बचपन में क्या करता था कि इन द चाइल्डहुड टाइम दे यूज टू लाइक द ऑक्लूडेड दिस आईज माय लाइक जो बेटर वाली आईज होती थी उसको बंद कर देते थे. तो मैं वो क्या बोलते हैं अमरीश पुरी बन के घूमता रहता था, ठीक है. सो एट दैट टाइम बट येट नॉट दैट मच इफेक्टिव, ठीक है. बट फिर भी मतलब कि 20 ईयर्स तक मेरे को कोई दिक्कत नहीं आई थी बिकॉज ऑफ द ऑक्लूजन थेरेपीज. दैट इज एम्ब्लोपिया की दिक्कत. बट अब दिक्कत होती है तो अब आई यूज द स्पेक्टिकल्स. And this was question which is asked in FMG Jet 2025. There is a two different numbers and one eye is lazy eye. That is an anisometric amblyopia, the diagnosis. Next one, bilateral papilloedema with the headache and the transient visual symptoms. Bilateral papilloedemas. Bilateral papilloedemas, that is a increase the what? Intracranial pressures. Now homonymous heminopia and the macular sparring, it is a typical PYQ of the NEET PG. That is a in the occipital cortex. That is in the occipital cortex. Next one, that laser which is used for the posterior capsule opacification after the cataract surgery. That is a ND-YAG laser. That is ND-YAG laser. So that one we need to remember. Next one, external nose which is made up of the bone and the cartilage. कितना ratio रहता है? That is a bone is the 1/3 and the cartilage is a 2/3. Next one, Bell's palsy which affect the facial muscle. कौन सी muscles? There is a ipsilateral upper and the lower muscles both. ठीक है, ipsilateral एक साइड वाली. नहीं, vision normal नहीं होता. That is a like the I have this one in the like the minus 3.5, but vision is not that much improved, but I have the one good eye, so I can compensate within that. Dr. Gato Radia don't feel like these kind of the things because of the, जब आप इतना खुद के बारे में इतना बुरा सोच सकते हो तो अच्छा भी सोच सकते हो. when you are thinking so much extreme, मतलब इतना एक्सट्रीम आपने खुद के लिए इतना सोच लिया, तो अच्छा भी सोच लो, क्या पता कभी चमत्कार हो जाता है. ठीक है, समटाइम इट्स हैपेंस. जो आपको आता है वही एग्जाम आ गया. ठीक है. नाउ क्वेश्चन नंबर 150, मसल अफेक्ट विच इज ट्रेंडलबर्ग गेट विच इज द राइट ड्रॉप. ट्रेंडलबर्ग गेट, ड्रॉप एंड स्टैंडिंग. तो यहाँ पर कौन सा अफेक्ट हुआ, राइट ड्रॉप हुआ ना, तो इट्स मीन ड्रॉप इन अपोजिट साइड, ड्रॉप अपोजिट साइड, स्टैंड सेम साइड, स्टैंड सेम साइड, स्टैंड ऑन द लेफ्ट. तो इट्स अ लेफ्ट gluteus medius and minimus maximus. It's not a like the not a part of this one. ठीक है, and it's supplied by the superior gluteal nerve. It's supplied by superior gluteal nerve. मैक्सिमस नहीं होता डॉक्टर सलाम. मीडियस मिनिमस. ओके. Lesion of the paracentral lobes affect what? Its perineum and legs. Testosterone synthesized by the cholesterol, that is synthesis from the cholesterol. That is the main thing, and it's synthesized by the leading cells. Synthesized by the leading cells. High altitude dyspnea occurs due to the what? It's a decrease the partial pressure of the oxygen. Partial pressure of the oxygen. High altitude पे respiratory will be the respiratory alkalosis. And then we will give the drug of choice, that high altitude पे माउंटेन सिकनेस पे we will give the acetazolamides. ठीक है, acetazolamide. ठीक है, and this acetazolamide will cause the what? Side effect which is metabolic acidosis, क्योंकि it's inhibit what? Inhibit the carbonic anhydrase, inhibit the carbonic anhydrase, inhibit the carbonic anhydrase, and which is the present on the PCT. और PCT वाले जितने भी disorder, these are the metabolic acidosis, like Fanconi anemias. These are the like PCT disorder, metabolic acidosis. Stand, हाँ तो वही तो बोल रहा हूँ डॉक्टर दिवस. दैट इज पेशेंट विच इज स्टैंड एंड सेम साइड, स्टैंड सेम साइड, यही तो लिखा है मैंने. ड्रॉप अपोजिट साइड, स्टैंड सेम साइड. तो ये स्टैंड की साइड है लेफ्ट में, तो इट विल बी अफेक्ट द लेफ्ट साइड. ट्रेंडलबर्ग गेट मींस इट्स लाइक द मिनिमस एंड द मीडियस वाला. हाँ डॉक्टर रेडी, इट विल बी द लाइक द एज मच एज कैन. ठीक है. So we are finishing this one. 154. The B48 and B100, that is formed separately due to the RNA editing. That is RNA editing, and they are the for the lipo, that LPL. ठीक है. And A1, the APO A1 किसका है? APO A1. A1 means something good वाली lipids, that is a HDL, high density. Anti-GBM antibodies, that is causing the hemoptysis and the hematurias. मैंने जब भी बोला बेसमेंट मेम्ब्रेन बात कर रहे हैं, वी आर डिस्कसिंग अबाउट द कोलेजन डिफेक्ट टाइप 4, and that is type 4 collagen defect type 4. Either it can be the Alport, either it can be good pastures, but anti-GBM antibodies, that is a good pastures, that is a good pastures. So that one we need to remove. High chance good pastures. And what is the complication of good pastures? That thymoma. ठीक है. Next one, what is the most common indication for elective splenectomy? That is a immune thrombocytopenia, immune thrombocytopenias, ITP. Now brachial cyst, which commonly arise from the which cleft of the remnant? That is second brachial cleft. Placenta, which completely covering the internal os. What kind of? That is complete placenta previa. Instrument, which is the traction device used to assist the delivery. That is a forceps with the traction. That is a forceps with the traction. हाँ, correct, Dr. Divas. Now 161, contraindications for the venous application, that is a prematurity, that is a prematurity. Now physiological skin pigmentation in the skin, that is a, यहाँ पर जो स्किन का पिगमेंटेशन होता है, दैट इज अ नाइग्रा. कौन सा वाला? लीनिया नाइग्रा, दैट इज अ लीनिया नाइग्रा. 163, that drug which is the not preferred in Parkinson's with the hypertension due to the orthostatic hypotension, it is a bromocriptins. And bromocriptins, which is the also we give in the like the prolactinomas, and also we give in the like the with the combination of the like this one dantrolene के साथ में न्यूरोलेप्टिक मैलिग्नेंट हाइपरथर्मिया. ठीक है. बेस्ट मेथड टू रिड्यूस द HPA axis suppression in the with the prednisolone, that is a alternative days therapy, alternative days therapies. We will not stop, we will alternate it. Okay. Next one, diet study among of the different religions, different religions in the Delhi, that is best sampling. It's a stratified random sampling, stratified random sampling. Next one, 166, sickness absence, that is a worker affect what? Health of the worker, that is a health of worker. Next one, best community method to teach the dog bite wound washing, what will be there? Wound washing, that one will be the demonstrations. Urchiria bankrupt का fileria का, that is already asked, that is a hathi power होगी, that elephantiasis, that is a most likely we will demonstrate is, so it will be the demonstrations. Investigation which is used for the nutritional status assessment in the community, that is a hemoglobin. Oxidation point work by the daytime aerobic and the nighttime anaerobic will be there. So neonatal resuscitation in the term baby start with the FiO2 at what the percent? 100%, 1%, 2%, 10%, 21%. It's a 21% room air. It's a 21% room air. So that one we need to remember. Now drug which is used to increase the exercise capacity and the slow the progression of the idiopathic pulmonary fibrosis. This is the pirfenidone. That is a pirfenidone. That one we need to remember. Next one, 172, which is the 100% exam question. That one we need to remember. That is a drug which is the like increase the neutrophils count after the chemotherapy. And before starting this drug, before the 30 to 60 minutes before, we give that paracetamol. We give the paracetamol because of the reduce that side effect of this drug. What is the name of this drug? This drug name which F, name start with the F. That is a filgrastim. That is a filgrastim. That is a 100% exam question. That is filgrastim. So that one we need to remember. Filgrastim. Okay, filgrastins. Now, drug which is acting on the RAS pathway and causing the rise in the renin level. That is a losartan. That is a losartan. Next one, which type of inhibition where is a Vmax decrease and the Kmax remains same? There is a three conditions. There is a competitive inhibitors, non-competitive and uncompetitive. Competitive, you will see the Km will be the same. Vmax will be the increase. In competitive, what kind of things will be there? Km will be the same. Vmax will be the increase. If Vmax is the what kind of that you will see? Competitive, that is a uncompetitive, non-competitive, and the uncompetitive both will be the decrease. In the non-competitive, what kind of things will be there? Vmax is decreasing. That is a non-competitive. That is a non-competitive. What things will be happening in the competitive one? Please clear this one. Competitive inhibitions. Km and the Vmax. Uncompetitive both will be the decrease. Okay. Both will be the decrease. Yes, that is the main thing. That one we need to remember. Km will be the Vmax will be the same in these conditions. That is the main confusing things. Km will be the increase. Sometimes brain is not braining. We discuss the multiple time. This is easy one. Last question. The patient present with a pain in the right iliac fossa, tenderness in the maximum at the Make-Burney points. The Make-Burney points, what will be the most likely diagnosis? And the what kind of incision we will do? Most common incision. That is a Lange incision. And what kind of the diagnosis? That is acute appendicitis. That is acute appendicitis. So that one we need to remember. We did this 175 questions in the fast minutes. Okay, and I hope so these things will work for you, and I will send you this PDF in the group. Okay, and do study that one. Go through once this PDF, and 100% these questions will be the worth it for you. And thank you so much for watching this one. Thank you so much for coming this one, and I'm praying for your best result, and I always will be the grateful for you, for your efforts, for your these kind of the hard work. And I'm the like the person who is the always will be the for you, for your the in the best part. एंड हमेशा हमेशा के लिए मैं क्या बोलते हैं उसको, मैंने आपके हार्डवर्क को देखा है, मैंने आपकी मेहनत को देखा है, ठीक है. व्हेन नो वन इज वाचिंग यू, आई सॉ दैट यू आर मेकिंग द एफर्ट्स, यू आर वर्किंग टिल द एंड, यू आर फाइटिंग टिल द एंड, ठीक है. थैंक यू सो मच, एंड इट वाज द ग्रेट, and we'll see you again, hope so, tomorrow. Bye bye, and don't lose any kind of hope, any kind of the hope, और कभी भी खुद को ऐसे कम नहीं आंकना है, ठीक है. और लास्ट तक फाइट लेनी है, और क्या पता कोई लास्ट में से कोई ऐसे क्वेश्चन आ जाए जो आपका सिलेक्शन करवा दे, ठीक है. तो कुछ भी ऐसा नेगेटिव नहीं सोचना, ऑलवेज बिलीव इन योर एफर्ट्स, ऑलवेज बिलीव इन द गुड थिंग्स, ठीक है. जो भी नेगेटिव बात करता है या कैसे भी करता है, तो उन लोगों से कुछ दिनों के लिए दूर रहो. उसके बाद जो भी फाइट करनी, जो जिस भी एजेंडे पे बात करनी, वी आर रेडी फॉर दैट वन, बट स्टिल अब के लिए नहीं करनी कुछ भी, है ना. ओके, थैंक यू सो मच, बाय बाय.